is Miss Asmita for the prayer.
तेजोमय गगन सदन तेजोमय तिमिर हरुण करुणाकर दे प्रकाश दे अभय गगन सदन तेजोमय गगन सदन छाया तव माया तव हेच परम पुण्यधाम छाया तव माया तव हेच परम पुण्यधाम वारातून ताऱ्यातून वाचले तुझेच नाम जगजीवन जनन मरण जगजीवन जनन मरण हे तुझेच रूप सदय गगन सदन तेजोमय गगन सदन वासंतिक कुसुमातून वासंतिक कुसुमातून तुझ मधुर हासतोस मेघांच्या धारातून प्रेमरूप भासतोस कधी येशील चपल चरण कधी येशील चपल चरण वाहिले तुलाच हृदय गगन सदन तेजोमय गगन सदन भवमोचन हे लोचन तुझसाठी दोन दिवे भवमोचन हे लोचन तुझसाठी दोन दिवे कंठातील स्वर मंजुळ भाव मधुर गीत नवे सकल शरण मनमोहन सकल शरण मनमोहन सृजन तूच तूच विलय गगन सदन तेजोमय गगन सदन तेजोमय 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 गगन सदन तेजोमय गगन सदन.
That was so soothing. It gives me immense pleasure to welcome the honorable dignitaries present among us on the dais. To start with the organizing secretary of the conference, Dr. Sandeep Mutha, please. The secretary of AORA, Dr. Vrishali Ponde, please ma'am. The President of AORA, Dr. J. Balavenkat Subramaniam, sir. The Academic Director of AORA, Dr. TVS Gopal, sir. Is he here? No, I think he is in the operation theatre. Our patron and Director of PACPL, Dr. A.D. Sun, sir. Our patron and the Head of Department of Anesthesia of SKNMC, Dr. R.W. Nafre, sir. Please, sir. And today's chief guest, our guest of honor and patron, our Dean, sir, Dr. A.V. Bhore, sir. Sir, we request you to join the dignitaries on the stage, please.
All dignitaries on stage, thank you very much for gracing the occasion. I would now request Dr. Sandeep Mutha to say a few words as part of the welcome address.
Dr. Sandeep Diwan, who is the organizing president, he is stuck up in the auditorium. So he has given me chance to address you all. Welcome you all to the third Academy of Regional Anesthesia Conference, which is being held here in Srimati Kashibai Navle Hospital, Nare, Pune. And because of you all only, that this extravaganza, academic extravaganza, is going to be a success. Thank you.
Dr. Bal Venkat, who is the president of AORA, will now give the presidential address.
Respected chief guest of this August evening function, the Dean of Navle Hospital, Dr. Bore, the patron of this conference and the head of the Department of Anesthesia, Dr. Nafde, senior anesthesiologist and patron of this conference, Dr. Sant, the organizing secretary, Dr. Sandeep Mutta, the secretary of AORA India chapter, Dr. Vrushali Ponde, the co-committee members of the Academy of Regional Anesthesia of India, including our treasurer, Dr. Satish Kulkarni, Dr. Ashit Mehta, the international faculties who have come from far and wide, who have taken their time out of their busy schedules, Professor Dr. Vincent Chan, Dr. Suganta Ganapati, Dr. Charles, Dr. Swarup Margale, Dr. Mardachalam, Dr. Sanjay Sinha, national faculty from various corners of this country, the faculty for both workshop as well as the conference, senior members of the profession, my teachers, I have plenty of teachers here, my teachers in Pune, and dear colleagues. It's indeed very nostalgic to be here in front of this August gathering in the lovely city of Pune, because I'm personally and emotionally attached to the city of Pune. I came here in the year 1999 after completing my MBBS as a young postgraduate to do my 2 years course in Diploma in Anesthesia through All India entrance at Sassoon General Hospital and BJ Medical College. When I came here, I came with only one intention, because my first choice was orthopedic surgery. So I thought I would do 6 months of anesthesia in BJ Medical College and Sassoon Hospital, learn the skills what the anesthesiologists have, like intubation and spinal, leave the course in 6 months and again take the next All India entrance and become an orthopedic surgeon. But I want to submit, I am an anesthesiologist today because of all my teachers in BJ Medical College and Sassoon Hospital, who made me realize that anesthesia is no less a specialty, and it's great to be an anesthesiologist. And so I changed my mind and continue in the field of anesthesia. So I'm personally and emotionally attached to the city of the Pune and BJ Medical College. And at this juncture, I would like to bow my head to all my teachers who made me realize that this is an excellent specialty and made me continue in this field of anesthesia. Today, when we did the workshop, I found it absolutely delighted, but at the same time uncomfortable, because I had many of my CRs and SRs coming to the workshop from whom I learned anesthesia. So it was pretty nostalgic, and at the same time, it was very humbling. So we are entering into the 4th year of Academy of Regional Anesthesia. Why do we need an organization like Academy of Regional Anesthesia for India? If all of you agree with me, with a vastly expanding Indian population, with the elderly population becoming increasingly high, and with the life expectancy increasing more than the yesteryears, the number of people who enter the 7th decade, 8th decade, and the 9th decade of life is increased. The life expectancy is more than before. And also because of our lifestyle modifications, we have gone into a state where 30% of Indians are diabetics. So diabetes, hypertension, and the comorbid conditions have equally increased, which means we see more number of patients as anesthesiologists for various surgical procedures with multiple comorbid and critical illness. So it becomes mandatory that we make sure that each one of us who are practicing in this era of anesthesia learn all the advances which takes place in the field of regional anesthesia, because with this you could provide site-specific analgesia to the respective part which needs to be anesthetized without going into a general anesthetic and the need for the postoperative care, which is not available in majority of the institutions when you do private work. Majority of the government institutions where we do not have a high dependency unit, a 1-to-1 nurse ratio, multi-parameter monitoring for all the patients in the postoperative period. We are developing, but we have certain limitations in the infrastructure which will make regional anesthesia far superior to general anesthesia, especially in the critically ill patients. So it becomes mandatory that each one of us have in our armamentarium the exact way to provide regional anesthesia to our patients, to make sure that we do not systemically alter his hemodynamics by your technique, and at the same time to see the patient walking back of the operating room with least disturbance to his systemic circulation and all the other parameters. Is there any other technique other than the regional anesthesia which would make this possible? Answer is no. So which means the answer is very clear that we need to become an expert in the regional anesthesia. Thanks to the development in the technology, that with the advent of the peripheral nerve stimulator and now the ultrasound guided regional anesthesia technique, we have become much more perfect in the art of giving regional anesthesia. Gone are the times when after giving the block, the heart rate of the anesthesiologist used to be more than that of the patient. Because you pray all the gods that are available in whom you pray to see that you request the God to help you to see the block work. Because if the block fails, then what happens is it terribly hurts your ego and the surgeon thinks you are not a very good anesthesiologist. So because of that, many of us have developed a lot of technique after giving the block, 100% sure that you know that it has not acted fully well. So what do? We put a screen, and in this, then you say that the patient, the block is almost taken except for a little bit sparing here and there. So he's a bit anxious. The block has taken, but he's a bit anxious. And then we only know that we slowly give a small dose of ketamine, midazolam, propofol, fentanyl, and we try to, our ego doesn't allow us to admit that the block didn't work. And so we slowly go into all these maneuvers to get a good name from the surgeon. But however, inside us, we know that the block didn't work. So gone are those days, and we are entering into a new era of safe practice of regional anesthesia with this advent of this modern technology. I urge and request each one of the anesthesiologists present here to try to progress into and enjoy the benefits of using these new gadgets for the benefit of our patients and for thoroughly enjoying the modern anesthetic practice. It's so beautiful to enter into this. You can say that I love paresthesia and I will continue to use paresthesia, but please, I think you need to rethink and you need to utilize all the new gadgets which is available and enjoy the new forms of anesthesia, which for sure gives the safety and gives the precision with which we deal with our patients, more so with the critically ill patients. At this important juncture, I would like to emphasize that the Academy of Regional Anesthesia has grown over the past 3 years, and I urge all of those who are interested in this to become members of the Academy of Regional Anesthesia, to help us strengthen this organization to do much more in the years to come, take this organization to all the peripheral places where the regional anesthesia is needed most, to conduct much more workshops in the future, even at the district levels and the state level, so that more anesthesiologists get benefited out of the workshops that we conduct. So we request all those who would be interested in regional anesthesia to become life members of this organization and help us grow. And we have a counter that's available near the registration counter, and we have a person, our secretary of AORA from Mumbai, who's sitting there to make you a life member. It's also very, very important that the safe practice has to be disseminated to all your colleagues who have not been part of this conference. Please take home the message of the surety and with the precision with which a regional anesthetic can be given to the patients without a question in mind. So we need more help from all of you to grow and to grow in the right way. It's also important that as a nation, when we are growing, We know that we have become a major player in the IT industry.